Hello and welcome to Healthy Seminars. My name is Lauren Brown. I'm the founder of Healthy Seminars. And today we are back with Debra Betts, and we're doing our series of what I wish I had included in my book. Debra's textbook is called Acupuncture in Pregnancy and Childbirth. I just want to do a little bit of housekeeping. Basically, this series, the author will do about a 20-minute lecture based on the questions that you have asked. One will get picked based on popularity of a theme or a topic, and then we'll leave about 10 minutes for Q&A for a total of about 30 minutes. Just want to let you know we've added Rebecca Avern to our list as well. She's going to be doing some on August 13th, September 10th, and September 24th of 2020. So same page here is where you can go and register for those. And Debra is here today on July 23rd, 2020, and soon her next one that's scheduled is August 6th. So you can register for that as well to continue to be part of what I wish I included in my book. And I've had a few other authors approach me that they want to do some of these. So this will grow, and we'll continue to have a couple of these a month where you can get some of that content that what didn't make it to their books. And the replays right now at this point in time are staying on this page for about 48 hours after the live webinar. I do want to let you know that Debra Betts has several online courses approved for continuing education on Healthy Seminars. So you can go to her bio page. And then always, if you go to the resources, you can go to the home page and just click on resources. It'll take you to this page, and you can see what upcoming live events that we have. So this is July 2020. You can see what live events that we have happening. And you can look in the future, and as we add stuff, this is where you will find it on the calendar. And this is both for non-CEU, like short lectures, as well as for those live webinars that are approved for CEU. They're both going to be showing up on this page. If we can bring up the disclaimer slide, that would be much appreciated. So I just want to remind you that this is for educational purposes only. This is not medical advice. This should not be interpreted as medical advice. If you have a health condition, please seek out a qualified healthcare provider. Again, this is for educational purposes only. So you can't say Debra says, or you can't say I saw this in Healthy Seminars. This is for entertainment, educational purposes. You do need to seek out a healthcare provider. All right, let's bring up our author and colleague, Debra Betts, a practitioner, nurse acupuncturist in New Zealand, and she wrote the text, The Essential Guide to Acupuncture, Pregnancy and Childbirth. I mentioned she has several online courses on Healthy Seminars, and she's really helped bring the confidence for acupuncturists to use acupuncture in pregnancy. And Debra, I'm curious, what do you wish you had included in your book?
Lots of things, Lorne, and thank you for your introduction. But can I just say that there's not a lot of thanks for the pressure of being entertaining. You said that this is for entertainment. I'm not sure about that. So but thank you both to your team, and especially Sandro and Dorian, for creating this opportunity. So to interact with people and find out what the issues that you have that the book doesn't answer. So yes, there's obviously lots of things that have come up, some because I didn't really consider them when I was writing, and some because the world has changed and things have changed in the way they treat women as, women's guidelines around care have changed as well. So this is a really nice chance to update. So from the questions last time we did looking at breach, and I was sort of making a call for people to collect your clinical data so that you can have some sort of ideas around what's happening in your clinic. And what came out of that was questions around breaches that weren't quite fitting the normal, physiological breach that you might normally see, uncomplicated breach. And so if you have a baby that's transverse, and I also get a lot of questions around twin pregnancies and breach. So I thought I'd touch on the topic of kind of keeping yourself safe, because it doesn't really matter if a woman shows up in front of you in clinic and she's got a breech baby that's transverse, or whether she's got a twin breech, or whether she's even scared, she wants a vaginal birth after having a cesarean. We call them VBACs here, but the consultant has told her she must have a cesarean section because of the certain risk factors in her pregnancy. Or you've got somebody who's showing up and they've got a history, might be to do with high blood pressure or something, and they're saying they're going to induce me, and they are asking you to do something to provide a treatment, and there's some risk factors. And I think the important thing is that you keep obviously you want to deliver a good treatment and keep the woman safe, but you also want to keep yourself safe as a health professional. And I thought I would just touch on that in terms of, I have always felt that that's a high consideration for me, is that I feel that I could go back to my notes and justify why I did the treatment that I did. And that has to be as a health professional, that's my role. So I'm just going to do a screen share, just some ideas. I was thinking about how can I sort of capture that in an easy format? And I just think that it is our scope of practice to make sure that we're safe. And I will run through how I differentiate breech, because that came up. If it's transverse or whatever, there's some straightforward answers to me around making sure that I do that. But I just think it's basically being aware of the red flags. And I think you need to put in your notes that this woman is presenting and that she has, a transverse position, or that's what she's been told, or that this woman is presenting and she wants a vaginal birth, but they've suggested that she needs a cesarean because of such and such, so that you actually demonstrate that there are some risk factors there in this pregnancy. I think that's number one. That you write down something about why you deliver the treatment that you deliver, so your rationale. And as Lorne said at the beginning, it was kind of a joke, but if something goes wrong, because these are high-risk pregnancies or even any risk pregnancy, there is always things that can happen. And that's just something to have in the back of your mind. So if something did happen and the baby, there was a stillbirth or complications with delivery because the woman did go into labour early before the planned cesarean section, and things happened, you need to have a rationale for your treatment. And I don't think a rationale that you heard at a lecture that someone said that you could induce this pregnancy, or that you could turn a transverse breech. I don't think that's not exactly something I'd be comfortable with presenting. So I think that you need to have an awareness that there could be a potential issue here. And then I think that you need to have the patient agree to your plan. So I'm sure all of us have, but there have been many incidences where I've sat in front of a woman and they're crying because they really want a vaginal birth, or they really want this baby to turn, and your actual treatment plan is to help prepare them for a cesarean section, because the risk factors are there, and they're fixated on having this vaginal birth, and I need them to consider that they're going to birth their baby, and there's all sorts of positive things we can do to make this cesarean section a birthing experience for them and their partner, and how we can make this work for them. But I need them on side, because there's no point me giving a treatment where they think I'm trying to turn the baby or induce their labour, when in fact that's not what my treatment is aimed at. Does that make sense? So it's just about being very clear about your rationale and what you're doing, and having the patient on board, because you do not want that person, if something goes wrong, and even if you do a nice, gentle, tonifying treatment to prepare for a cesarean section, but the woman thinks you're trying to induce her, or you've got twin pregnancy and one of the babies becomes compromised, and the woman thinks you've tried to help her turn her babies, you do not want her saying to her obstetrician or her medical team that the acupuncturist was trying to do this, because that in her head is what you were trying to do. And then I think just really understand the guidelines that can be used and the evidence base that you can use for your rationale. And although, there are some issues in pregnancy, I think they're very few and they're not difficult to understand. And all the guidelines, the American ones and the British ones and the Australian ones and New Zealand ones and Canadian ones are all online. So you can find the medical guidelines for recommendation online. So I think that that's just part of our continuing education, part of our practice. So that's just kind of a question that I think, number one, when you've got a patient in front of you, is thinking, are you safe? Are you keeping yourself professionally safe? And that's how I would kind of approach that. And then, Lauren, why can't I? Oh, yeah, here we go. I can now move this down. So, in particular for the breech. So the question came up about the transverse breech. And, number one, a lot of the research studies, as it's pretty obvious, they only do these in uncomplicated pregnancies. So when you have uncomplicated pregnancies, you have the research base to back you up about safety. If there is any complications, these women are not on the trials, so it becomes a slightly different presentation. And I wanted to say, because people kept coming back last week and after, there were several questions about the British acupuncture guidelines and transverse. The number one thing for a complicated breech pregnancy, and it doesn't matter whether whether the baby is slightly small or there's any other issue with this, is that it comes up in the guidelines under ECVs. So what seems quite straightforward to me is if the woman has been offered an ECV, everybody should be really happy that they're offered moxibustion, because the guidelines in 2017 said that women may wish to consider moxibustion for breech presentation under the guidance of a trained practitioner, which is you. And this is in the ECV guidelines. So this isn't the breech guidelines. This is not saying any woman with breech might like to consider moxibustion. This is being aware that this is the guideline for ECVs. So I think you're totally covered. I feel totally covered that if a woman turns up and they say, yes, I've got this issue, they're worried about the growth of the baby, or it seems to be in a transverse position, or I've got diabetes, or I've got high blood pressure, but they've scheduled me for an ECV in next week. I'm reasonably happy with this. If you feel at all a little bit uncertain, I would delay until you get medical agreement. Just keep yourself safe and be aware of what your hospital, what your area is doing. However, if the woman's saying, no, I can't have an ECV because they think it's too dangerous, that is not a time where I want to put my hand up and say, oh, no, don't worry, we can offer you moxibustion, everything will be fine. So I hope that clarifies the concept last time when I was talking about when the question came up. To me, if a woman's been offered an ECV, that gives you a lot of leeway to think about offering moxibustion, even if there's complications. However, if you feel at all feeling that it may not be a safe thing to do, I would delay it and until you get and treat the woman for something else. Talk about tonification, talk about sleep, talk about increasing amniotic fluid, talk about looking at her as an individualistic treatment first, as a primer, talk about reducing the stress on the back, talk about increasing, making sure that the ligaments into the uterus, doing treatment to release the ligaments in the uterus, to release the lower back. All of that is birth preparation. So I'd certainly, and you might want to phrase it as, let's, for this first treatment, prepare your body, release the muscles in your lower back, look at the ligaments, look at trying to increase amniotic fluid so that when you come back and when we've got this permission in your special case that they're happy to use the moxibustion for moving the baby, we do that. So that's kind of my thoughts on this. And just as a kind of a little chart here, this is just saying the same thing but with little arrows, is that on uncomplicated breaches, if you've got a breach with any type of medical complication, if the woman has an ECV planned and you've got medical consent, I'm happy to go ahead. And I do see some complicated pregnancies, not very many, and sometimes they actually themselves are midwives and they want to try this, and that you can just document it, that you've got medical consent. However, if you've got, say, something like a twin pregnancy, that's also quite a complicated pregnancy, really need to look at sharing of a placenta, and if you've got medical consent, and if that pregnancy is uncomplicated, before going ahead with the moxibustion treatment. And often, because so many of these twin pregnancies are complicated and very few are actually two separate twin pregnancies, that they're not sharing a placenta, often you are actually talking to this woman about how to prepare for a C-section and how to birth their baby through having a positive C-section. So that nearly takes me up to my time limit, I think. I'll stop sharing.
Thank you, Debra. Let's see if is there any questions related to what Debra just presented? You're welcome to either raise your hand digitally or you can post a question. And while you're getting ready to type or ask a question, Debra, there was one person, it's off topic. How do you answer this one? They just want to know, they were curious why you did not have gestational high blood pressure in your textbook.
Yeah, well, that isn't. I can make that the next one because that's a whole issue around treating.
So it was on purpose, though. It wasn't like, oh my God, I left it out. There's a reason for that, which we're not going to talk about now. Just to stay on topic.
Well, I just assumed. I made assumptions about what I thought of as that you were just treated as normal high blood pressure because it's different from preeclampsia, and I thought that it wasn't worth writing a chapter on high blood pressure and then writing a chapter on preeclampsia when the treatment is really the same. So because the high blood pressure can turn into preeclampsia. So I just kind of cut it out as a separate chapter. It's like I didn't put in headaches because I thought, well, you people would just do it the same. I mean, there was lots of stuff. It didn't turn into, it was an assumption. It could have been a lot larger, the book.
I know. Eventually, you gotta say, I'm done. I gotta get this out, right?
Well, this is why I owe thanks to Peter Deadman. I could still be writing. I mean, the book took like 4 years, but it could have gone on for a lot longer. So,
I want to remind everybody that the link for the replay and future what I wish I included in my textbook or my book is on healthyseminars.com/wish. All right, a question has come in. Can you discuss how you treat pregnant patients with cold or flu? Is there anything different that you do for treatment or recommendations you give them to do at home? So somebody comes in with a gamma, a cold, or a flu.
Yeah, lots. I think again. So did we have any around people wanting to about the safety issue? Because there are some on my website. You'll find things around home advice I give for cold and flu, and it is really important because women, the ribs are stretched, so the coughing I've seen women who've actually got a lot of rib strain, a lot of rib pain, someone even with fractured ribs from all the coughing, etc., and colds and flu, because your ribs don't work. The breathing is really changed. So it's really important to treat. So I can go into that in the 5 or so minutes we've got left. But was there anything around, did anyone want to say anything about agreeing or disagreeing with this idea of safety? Because I do get a lot of emails about people kind of wanting me to give them permission to treat someone. And I'm always going back and saying, well, actually, it really depends on your guidelines, on what your hospital policies are, on your own, comfortableness with this. And you always have the option of doing constitutional treatments for that woman to prepare her for birth without needing to engage in turning the breech baby or inducing. So I think that's your role as a practitioner.
Yeah, you gave a good job at explaining that. And I think the only other question that's come in right now that's related to that is when do you not use Moxo for breech then?
I always do.
Okay. Unless it's not safe, like they're not going to do the...
Unless I'm not trying to turn the baby. And I want to be very clear with the woman that I'm not, because I don't want that baby to get distressed. And you saw in my figures that I did last week, there was a woman who had a scan and they booked her. She went home, packed her bag and went straight in for a cesarean section the next day because they were so concerned that the baby was compromised. So you do not want to have someone, a compromised position where that becomes someone coming back and said, oh, I did the Moxo and then the baby got distressed and I had to have an emergency cesarean and this terrible event happened. Could it have been my Moxo treatment? Yeah.
I think you covered the safety issue well. That's why you're probably not seeing a ton of questions on it. I just want to remind everybody, these are short and sweet. So again, thank you, Debra, for this. Just want to remind people what's coming up this weekend. In the next free webinar, we have one on the emotional side. And so it's one of our Conscious Tuesdays. So go to the site and you can sign up for that now as well.
Watch the guidelines for what your area practices because they can change with different consultants. So you just really need to know what's acceptable in your area of practice so that you keep yourself safe. Okay, a lot of fun. Thank you, guys, and love to answer lots of questions. And Lorne, we could always make this an hour session. No,
yes, we could.
He really wants to keep this short.
I keep thinking about our attention spans, right? So I'm going with the flow. I think more often shorter. It's nice. It's nice. Yeah. 20 minutes, 30 minutes, and you're done.
It's fine.
An hour gets intimidating, right, guys?
I know. I get it, Lorne.
If you want more time with Debra, she's got hours and hours and hours online. So you can, you guys can spend all the time you want. Debra, if I'm going to spend an hour with you, it's because we're drinking red wine and eating your lamb in New Zealand, right?
Yeah. Good.
Bye, everybody. Take good care.
Bye. Send me your questions.
Oh yeah, next week. Not next week. August. What was it?
It's 2 weeks. 2 weeks,
right? August 6th.
August 6th. So check out healthyseminars.com/wish or go off of the resource page and you can find out the links there. If it doesn't work, hit refresh, Sandra says, because he's made the link live that you can sign up for the Zoom room. And you can start submitting questions for that as well. We are looking at them. So, if we get several on a topic, that's how Debra's choosing the topic. So if you have a question, do ask for it, because today we didn't have a ton on the safety issue, but last week we did on breech. And normally we don't go off topic like we did on colds and flus today. But if we have the time, we will. You get a better chance of your question being answered by Debra if you email it in advance to the team. Sandra, thanks for jumping in there as well, because you got some of those questions. I appreciate it. Debra, again, thank you for your time. And for you guys, thanks for joining in. Appreciate seeing your faces. Until next time, take care.